Good morning. I'm Angeline. I'm a counsellor with NAMS. Okay, maybe I'll just start with sharing this quote from an Irish playwright with you. It says, "Alcohol is the anesthesia by which we endure the operation of life." When we pause and just think about this quote for a while, you could see that it really highlights that, the relationship people have with alcohol, usually it's not a simple one. Our clients would say that their relationship with alcohol very much is like a love-hate relationship. Many times it's painful, but also comforting at other times as well. I think many people start off drinking alcohol maybe as a form of enjoyment, when you take a sip of two after work. But for many other people, it can also be a way of really numbing really very painful emotions like feelings of shame, anxiety, or even really distress and loneliness. Okay. So, considering this, treatment of alcoholism actually is really a challenging one because there are multiple hurdles that an alcoholic might need to cross. Okay, we talk about, imagine if you're just sharing a very close relationship with alcohol, breaking off this relationship itself can be very scary. Who do people turn to after breaking off this relationship? That will be one question on their mind. Okay, that could be a form of, we call it psychological dependence on alcohol. On the other hand, there's another group of people that probably Dr. Kandasamy has shared. People who have been drinking, perhaps, have developed a dependence on alcohol, and when they stop, they develop really bad withdrawal, and the only way, to stop this withdrawal for them is to continue drinking. Right? Okay, so when we talk about treatment of alcoholism, we need to consider there's different factors, for any treatment to be effective. And so some of the common responses we have, from our clients in NAMS, we have a group of people who say, "I don't have a problem, I can stop drinking anytime." Or maybe my family members are the ones with the problem, just exaggerating my condition. I always hear this from the younger group of people. And it's no wonder that family members are the ones referring them for treatment, because these individuals, though they might not be drinking daily, but each time they drink, get intoxicated, get into all kinds of trouble, with people coming with head injuries referred by general hospitals, people who have threatened suicide, and that really is stressful and frustrating for the family members. Right? And so, but there's also another group of people as well. Says, they recognize that alcohol itself and alcohol use has been a problem for them, especially with their health. And normally these are the people who are really more keen, and considering treatment. But there's always the other side of it, that, I have these health problems, but if I stop using alcohol, I might have a sleeping problem. And that's that's a very ambivalent relationship with alcohol. And truly, I think alcohol does disrupt this normal sleep cycle, okay, and it can take weeks and even months for this to be restored. And that's something that's supposed to be also, something, that you kind of need to manage the expectations as well. Okay, so we see here, there's different stages of change. I'm not sure they're familiar with this. At the one extreme of it, it's people who are not ready at all for change, and many times are the younger ones that I see at least. People who think, it's okay to binge drink, my friends are doing it, my friends are holding their liquor really well. Okay, and there's no reasons for change, especially when you're not experiencing any health problems. I think this group of people, actually, that's when family involvement is important. Actually, in fact, parental involvement, it's always helpful. If you are a parent, or a parent to be as well, I think what you could do really is, one of the things is to really make a stand, really clear stand on your attitude towards drinking, where, who, and when to drink. That's one, and also setting really a good example for the child. And setting a good example doesn't mean about the amount of frequency that you drink, but as well as how you cope with problems in your life. If you're turning to a certain substance each time and you're feeling distress, that's something that the child models after. I think also helps for parents sometimes to just engage the children in a variety of actually healthy interests. That alcohol is not just one of the enjoyment or something rewarding for the person. Okay, and of course, there are people who have probably at a stage of just thinking about it. Okay, and that's when we come in really listening to their concerns about stopping the use of alcohol. Okay, as well as what are some problems that they face, and weighing these two concerns as well as problems related to drinking. and also assuring them, that you will be available and there if they decide to seek treatment. I think many times when we look at this as well, parents would be really, or family members, concerned, people who are probably at the stage of preparing for change, but the individual itself might still be at a stage of thinking about it. And when we hasten this and hurry this process, what happens? It gets really a very adverse reactions from the individual. But I also like to draw your attention to this little thing at the side. It says relapses or sliding backwards occasionally is not unusual. In these all different stages of change, I think something to emphasize is relapse, as it's a common occurrence in the treatment of alcoholism. Okay, especially the first 12 months of abstinence. First 12 months actually could be a really critical period as well, and relapses are quite common during this period of time. Okay, right, and so. Okay, and when somebody is just ready and they recognize and preparing for action and change, one of the questions that we often encounter is controlled drinking or abstinence. Okay. And some considerations you might want to think about. It's one, have you managed controlled drinking in the past? If you're someone who has not been able to keep to a safe limit of drinking, or you often get in some kind of trouble when you're intoxicated, then perhaps abstinence, which is completely stopping drinking, might be a safer option. Or do you have an alcohol use disorder? If you have an alcohol dependence, one sip of drink often escalates into uncontrollable drinking. Okay? Though you might think I've stopped drinking for a month or 2 months, I think I can manage just one drink. Okay? And often, though you think you can, but the body remembers, and body quickly develops a tolerance to the drink. Right? And the next one I thought was also very important. Sometimes drinking itself is also not just a personal decision for one, but as well as what would your loved ones say about your decision. Okay, something that we often miss. If you're thinking, well, I can't do controlled drinking, but your family members might have certain observation or concerns about your controlled drinking. Okay, that can create tension in the relationship and then become a trigger to drinking again. Okay, and that's why family involvement is always important in your treatment. Do you have significant health problems? Okay, that I think has been elaborated very much by doctors. And are you planning for pregnancy? Because this applies to the women. If you're planning for pregnancy, probably you have heard of the fetal alcohol syndrome, where the drinking and your child, the fetus might develop mental and physical defects, right? And what types of support do you have if you choose controlled drinking? Do you have a safe group of people who you can drink with and keep to safe limits of drinking? Are these people able to help you monitor the amount that you drink? Okay. Or you have family members who can help you manage your finances, that you don't spend a lot on drinking. Okay. That's another consideration. Of course, if you're taking certain types of medication, it really helps to ask doctor, on certain medications can interact with alcohol and really create really bad reactions. Right. Having said so, and you're probably, if you're excited that you're thinking, wow, tomorrow is an auspicious day to stop drinking, maybe it's really to think carefully for once, because drastic reduction of alcohol can be dangerous. Okay? I'm not sure if you heard of this withdrawal symptom. It's called delirium tremens. Okay? That's when people get confused, in confusion, disoriented, into rapid heart rates, hypertension, different really life-threatening conditions if they stop drinking. Usually symptoms appear 2 to 3 days after you stop, right? Or they can develop a seizure when you stop. So we advise that you seek treatment. You can seek a doctor treatment with medication, can help to reduce the withdrawal. Right. So there's truly no one size that fits all. Helps to tailor treatment to individuals' needs as well. And we often say alcoholism sometimes is a symptom of underlying problems and so on, right? And so here in NAMS, we work already within a multidisciplinary team of doctors, psychologists, counselors, nurses, social workers, believing that with a multi-helping hands approach, could treat alcoholism more effectively, right? Okay, very quick glance at the treatment services that you can consider. Inpatient treatment, which is like staying in the ward, this is usually recommended for people who probably have developed a certain alcohol dependence, and you might have really bad withdrawals if you stop on your own. That's when you can consider staying in the ward Okay, that's one. Of course, for people who have tried stopping for many, many times but couldn't do so, okay, that's also inpatient will be another consideration. Yeah. Detoxification here in NEMS is a 1-week detox program, followed by a 2 weeks rehabilitation program, where our patients will join groups and also hearing experiences from others, and also discussing issues on how to maintain sobriety. Right. And then pharmacotherapy, I think you've heard about medication, and if you're interested, you could ask a bit more maybe in the panel later, or check with your doctor as well. We have medication who can help with the cravings of alcoholism. Some medication when taken, and if you use alcohol, can create such an adverse reaction that can stop the person, or deter the person from drinking. Okay, that's another consideration. But medication often go hand in hand with counseling, support, groups, as well as family, and I'm going to elaborate a bit more on these. Okay. Individual counseling. When we say no one size fits all, right? This is where individual counseling comes into play, because you and your individual counselor would probably look a bit more in depth into probably what's maintaining and the drinking. And education really comes also in the form of safe limits, sharing on what are the recommended limits of drinking. And for some patients, you realize it helps just to take note of the amount that you drink, which day, the amount, as well as who you drink with and what happens after that. Sometimes for some people, they would say just consciously taking note of this itself slows down the process of drinking, for one, and also helps you to keep to that safe limits of drinking. Okay? And of course, other things you probably would also have known is that drinking itself, when you're drinking, not drink on an empty stomach, okay, and drink slowly, and alternate the drinks with a non-alcoholic drink. Okay. Activity scheduling. So if you stop drinking, many times people wonder, like, what do I do with my time? Just now Suresh said that your life and in alcoholism, your life will just revolving around the bottle, right? And so now when you're contemplating recovery, you had to almost reorientate your life again around recovery. Okay? And so activity scheduling might involve just revisiting hobbies or things that you used to enjoy, but you have missed out, neglected when you're drinking. Okay, coming back to that. And when we talk about activities, I think it really has twofold benefits. One hand, it helps you, okay, as a way of relieving stress. Another way is really expanding the social support for yourself also. And of course, relapse prevention, and everything is well. And you thought, that's on the road to recovery as well. There's also a lot of things that you might need to also be very aware of. Firstly, identifying high-risk situations. What are high-risk situations? Okay, they are situations that makes it really challenging for you to stop engaging in problematic drinking. Can be like the Christmas season, right? Just around the corner. Could be really like people partying away. That's one high-risk situation. But even in festive seasons, it might not just be partying. It can, for some people, make loneliness more pronounced as well. Also, okay? And that could be the high-risk situation for that person. We also hear of how high-risk places where it's dangerous to drink could be even in places where you thought it's the safest, at your home. Okay, that's when people might just stash bottles away, and you could drink at home without anybody knowing, right? And that's another thing that we have to take note and identify, right? Seeing relapse as a process, not an event. Relapse doesn't happen with that one drink. Okay? Many times there are really many warning signs that lead to the relapse, as some of you probably would have known as well. Okay, we have patients who have been, when you stop drinking for a month, 2 months, and you haven't been able to do so in your life, that is really an achievement for many people. You suddenly feel at the top of the world, feel really, really good about yourself. But at that point, it also can be a trigger point as well, because then you start to think and let your guard down and think that, well, maybe I can really control my drinks. Okay, and that can be really a trigger to relapse. On the other hand, there are also individuals, they're just happy and they thought everything is going smoothly for them, but there are some problems that just won't go away, right? For example, there are bills that remain unpaid, you still might be unemployed, okay? Or you have family members who still find it really hard to trust you after some time. We have people who say, families will keep calling every hourly to just find out where they are, right? And so, this itself, and then suddenly you wonder whether stopping drinking is really worth it after all, whether recovery is worth all the efforts. And you might just decide, that's it, I'm going to drink again. Okay? So be alert to all these warning signs. Okay, it's critical. Okay, I'm going to just also share a bit on expectations. If you have been drinking for long periods of time, what tends to happen is that you might have missed out on your children's developmental years. And then when you're sober and you want to actually play that role of a parent really well and really excited about it, what happens is that your child might not be ready to welcome that also. Okay, and that can itself, and this building of relationship takes time, right? At the same time, we also hear of patients who say that, well, sometimes you feel really left behind while all your peers are really rebuilding their career, starting a family, and here you are really stuck at that, fixated at the point. And that for them can be really anxiety-provoking. And so managing expectations, knowing that recovery takes time, knowing that to foresee all these different challenges in life can help as well to maintain abstinence. Social pressures. I think I have this, the opportunity to work with young people and youth. And normally for young people, drinking itself is really a way of peer acceptance. Using their lingo, if you don't drink, you're not steady. So if you're not steady with somebody, it sometimes means that, I might be left out from my peer group. And so addressing social pressures also mean learning and being assertive and saying no to excessive drinking. Okay. Of course, just the last 2 points, establishing healthy support, okay, and that sometimes also means having to be a bit thick-skinned, going back and looking in your contacts and finding that people probably have lost touch with for a long time, and then coming and re-establishing contact again with these non-drinking people as well. Okay. Of course, we talk about developing emotion regulation skills when the first thought is to reach out for the bottle when you're feeling distressed or feeling really, really coping with very difficult emotions. And this time you probably need to ask, how do other people cope really with very painful emotions? Okay. And there's always something magical about, talking to people. Somehow there will be some exchanges with people that you can feel really relief after speaking to them. Okay, or even getting really good advice from people. Okay, and so later on we'll also be sharing a bit about the support groups available as well. Family, I think Suresh has talked quite at length on working with family. We have always said that alcoholism is not just a chronic relapsing disease for the individual, but also a family disease because of the extent of impact it has on family members. Just also going to highlight codependency, adding on to what Suresh has said about enabling behavior. If you have a family member here with us, sometimes we talk about enabling behaviors are behaviors that can encourage the person to continue drinking. You'll be wondering how do family members encourage, you just want them to stop. But in some acts, for example, we have people who might call up the alcoholic employer and saying that, if he's working, that no, he can't come forward. So you're just covering up for him, that's one. Or lying on behalf of the person, okay, on family gatherings, it's not explaining his absence to the family members, that's another. Okay. Also, for some, it's even giving them money to buy drinks, right? And sometimes for family members, it gets to a point that you feel so tired, so weary, that you think, if I cannot fight them, I would just join them, right? Start drinking as well with the alcoholics. Okay? Psychoeducation. I think one of the things that I really want to emphasize to all of us here is that recovery can be a long, long journey. Okay? And as a family member, it can be really a tiring process, okay, but can also be a rewarding process. But because it's such a journey, and with relapses as something common, okay, it also means that family members, you do need to also considering taking part as well in the treatment process for one, and also getting support for yourself. Okay, here in us, we do have support groups. If you have a family member registered as a patient with us, you could join our support group. It's called FRESH. Okay, Families in Recovery through Education, Support, and Hope. Okay. And of course, we spoke about support groups. Okay, just quoting from the Psychotherapy is Yalom. The power of groups to counter prevailing pressures to drink, to provide support, to offer role models, and to harness the power of peer pressure. Always something very powerful about groups. I don't know if you know. Okay, individual counseling for one, going hand in hand with support group is something, even another buffer and another additional support for the individual. And so support groups, NAMS groups, okay, in our department, we have 2 ongoing support groups for the individual. And another support group is, I believe, very familiar to many of us here. It's Alcoholics Anonymous. Okay, and the criteria for membership, AA would say, it's just the desire to stop drinking. Okay, and this is really like a fellowship of people who have struggling with alcohol-related problems and want to stop drinking. Come share their experiences, and that's a really wonderful learning opportunity. All right. So having shared very quickly about the glance on the treatment services available, we also want to inform you also of the referral process as well. Okay, if you have a pen and paper, you might want to take note of this. The appointments helpline is 6389-2200, or you could call our addictions helpline. Okay, our addictions helpline is manned by a group of para-counselors, operating hours from 8:30 to 10 p.m. every Monday to Friday. Okay, if you do need somebody to speak to, seek advice from, you could actually call this helpline. Okay, so what happens if you call? What you just have to do is to also provide, if you're intending to come here for treatment, just provide your brief particulars, also share a bit about the addiction history, and you'll be contacted within a day for a scheduled appointment. Right? So it's a very fast, very quick process. Alright, so you heard about, thank you really for sitting through this time as well. And so you see bondage, right? Sometimes bondage to alcohol can really be really very, very challenging. But it also, but recovery, it's, people are truly resilient, if we just use what was said earlier. And breaking this bondage to recovery can happen with collaborated efforts from individuals, from family members, from professionals, right? And from support groups. And really want to emphasize that you are not alone. Okay, and with this, we want to thank you so much for your attendance and attention. Okay, so have a good day.